Hi, this is Brian with Open Dental Software, and today we're going to be doing an ECW clinical training. So this training is designed for clinical staff to cover how to transfer information from Open Dental to eClinicalWorks and back, and how to use Open Dental to do your dental charting. So we're going to start off here in eClinicalWorks. eClinicalWorks is going to be the primary software for everything that is not specifically related to dental. So for example, all of the demographics and appointments will be handled by eClinicalWorks. So when you create a new patient, you'll do that in eClinicalWorks. If you need to update a patient's address, that'll be done in eClinicalWorks as well. That information will automatically transfer into Open Dental. When you create appointments, those appointments will be created in eClinicalWorks and will automatically transfer to Open Dental as well. You'll use eClinicalWorks to enter all of your medications, allergies, problems, medical history, all that information. Any meaningful use data for EHR purposes will be entered into eClinicalWorks. Your billing, statements, patient payments, insurance claims, all of that information will be handled by eClinicalWorks. That allows you to use the same process for your dental patients as you would use for your medical patients. What you're going to use Open Dental for is dental charting, treatment planning, and potentially for pre-authorizations if you do if you enter the insurance information into Open Dental as well as eClinicalWorks. So we'll cover that again in a little bit here. For now, we'll go ahead and get started. So the first step, I'm going to pretend a patient has called in for the first time, and we're going to create the patient in eClinicalWorks. So I'm going to use this patient lookup tool and create a new patient. Now, this should all be covered by your eClinicalWorks training, so there may be other ways to do this. There may be other tricks to creating your patients. You can specify information. Certain information may be required by default for EHR purposes. I'm just going to kind of run through fairly quickly how to do this stuff in eClinicalWorks. So we'll enter some basic information for our patient. Okay, so now I've created my patient in eClinicalWorks. Now again, the patient automatically exists in Open Dental. I don't have to re-enter that information. It's already been sent over to Open Dental, and that patient already exists. The next step is to create an appointment. So I'm going to double-click on my resource scheduler here. I'll select a facility, select my patient, and I'm going to select a visit type. Now, it's very important that this visit type be a dental visit type. So it doesn't actually have to be called dental. It could be, you can name it whatever you want. You can have as many as you want. But eClinicalWorks needs to know that that is a dental visit type. So for example, this needs to be flagged in eClinicalWorks as a dental new patient visit type. Everything should be set up correctly when we first install the system, but the important thing is that if you add a new visit type, you'll need to create a ticket with eClinicalWorks to let them know that you want this new visit type to be considered a dental visit type. If it's not set up correctly, then eClinicalWorks will not send a message to Open Dental, and then the appointment might not show up in Open Dental. So just make sure that if you set up a new visit type, you set it up as a dental visit type. So for now, I'm just going to choose this one, the dental type, and I'm going to say OK. It's going to warn me that it's not within my normal working hours, which is fine, so I'll say yes. And here's my appointment in eClinicalWorks. From here, I would probably go ahead and get information on medications, allergies, medical history, insurance information, all that kind of general stuff. And then when I'm actually ready to look at the patient's dental chart, I would right-click on my appointment and say View Dental Chart. That's the first way to get to Open Dental, is through the resource scheduler, right-click on the appointment, View Dental Chart. Another way, if you're on the scheduling window here, I can go to my resource here, and I can see my encounter here. If I were to double-click on my encounter here, that would take me to Open Dental as well. The third way to get to Open Dental, if you're already in the patient's progress notes, there's a button, a little green arrow next to Details here, that also gives me the View Dental Chart option. So 3 different ways to get into Open Dental depending on where you are in eClinicalWorks. Before we actually launch Open Dental, the last thing I want to point out here in eClinicalWorks is the medical panel here. So this panel will always be here in the progress notes for your patients. It lists things like current medications, allergies, immunizations. If I go to the other tabs, it lists lab cases, referrals, patient documents. It lists history here, medical history, family history. All of this information is available in OpenDental. So this medical panel here is available exactly like this in OpenDental. So that's why, even though you're going to enter your medications and your allergies into eClinicalWorks, they're still available in OpenDental through this medical panel. So now we're ready to go into OpenDental. So I'm going to click on my arrow here and say View Dental Chart. And here's OpenDental. So brief overview, we have our tooth chart up here in the top right corner. The teeth are all movable, rotatable. As we chart treatment, it's going to show up on there. So it's a really great quick snapshot of the status of the patient. In the bottom right here, we have the medical panel that we discussed. I have all my tabs. I have my medical history will be available here. Over here on the left, I have my appointment. So this is my clinical notes area. The only thing here now is my appointment because it is a new patient. And up here I have my area where we would go to enter treatment. So we'll get a lot of practice at this area. At the top of the screen, I can see my patient's name, so I can see that the correct patient did pull up from eClinicalWorks. And they have a patient ID number here. This ID number matches their ID number in eClinicalWorks. And I can also see the patient's name down here in the medical panel, so I can verify that this is definitely the information for the correct patient. So the first thing I want to do for my new patient here is I'm going to kind of match the tooth chart to the status of the patient's mouth. So the first thing I might want to do is indicate some missing teeth. So I'm going to go ahead and indicate a couple of missing teeth. Now I can click on the number, or I can click anywhere on the tooth. I can even click and drag and highlight multiple teeth at once. It's very easy to select teeth in OpenDental, and I'll indicate these teeth are missing. If I want to, I can even hide the little number there just to kind of clean up the tooth chart, make it look a little bit nicer. I can unhide those numbers. I can easily put the teeth back in if I make a mistake, and I can easily mark the patient edentulous with a single button. Next up, maybe I want to indicate some movements. So for example, maybe I want to indicate an impacted tooth. So we'll go ahead and do maybe a mesial tip and an occlusal shift here. If I shift it far enough, it'll actually turn gray to indicate unerupted. And I can easily do rotation, mesial tip, and labial tip in degrees. And I can do mesial, occlusal, and labial shift in millimeters. Lots of different things you can indicate here, maybe interior crowding, impacted teeth, really easy to match the status of the patient's mouth. Next up, the primary versus permanent. I can easily set all my teeth as primary, set them all as permanent, or set them to a mixed dentition, which is the standard for around 8 to 12 years old. From here I can choose specific teeth, and it doesn't matter if I choose the letter or the number, and I can indicate that those teeth are permanent. For now, we'll go ahead and set all the teeth as permanent for our demo. And we'll go back to our Enter Treatment tab. So on the Enter Treatment tab, there's kind of a lot of information in this little area here. So we'll start on the left. We have surface buttons here. So if we wanted to indicate maybe a filling, we might need to indicate some surfaces. So this is where we would choose our surfaces. OpenDental will automatically choose occlusal versus incisal for, depending on if it's an anterior or posterior tooth. We have our entry status here. So treatment plan is pretty obvious. It's something that just needs to be done for our patient. Completed work, you usually won't chart directly to completed work. Typically, you will treatment plan procedures and then set them complete. If you do want to chart directly to completed status, you can do that. We have two statuses here for existing work. So this would be work that had been done in the past, maybe at another time. One for existing current provider or existing other. So existing other we'll use to chart some work that our patient came in with, just to indicate that it's there, but it was done by a different office in the past. Referred work would be for work that we're going to refer out to someone else. And condition is just kind of another status you can use to track something else if you wanted to. For now, we'll go ahead and leave it on existing other. So the first thing we'll chart for our patient is any existing work. Maybe there's a couple of fillings that currently exist that we want to indicate. I can change the date. So typically you would enter stuff for today's date, but if you completed something last week and forgot to chart it, you could always come in and change the date here to chart it with a date of last week. I can enter a diagnosis. This is completely customizable. You can change these settings. add new things to the lists. These are not linked to ICD-9 or ICD-10 codes. There's a place that you can enter ICD codes that will transfer to eClinicalWorks, but this is not it. If you enter this diagnosis, it will be here in Open Dental, but it will not transfer to eClinicalWorks. So keep that in mind. I can enter a prognosis. Again, this is customizable. You can add things from this list. I could enter a priority. We'll cover priorities. Usually you would enter the priority from the treatment plan module, but you can enter it from here as well. And then this area here is where I go to choose which procedure I want to chart. So the easiest way, by far the best way to chart work is going to be using these buttons in the middle of the screen. We call them procedure buttons. These are completely customizable. You can add new codes, remove codes. You can create your own new codes based on what procedures your office uses the most. These buttons can do multiple things. So for example, you could have a new patient visit button that would automatically chart a comp exam, a pano, a prophy, and a fluoride. You could set up these buttons to do almost anything you want. They can do multiple codes with one button. They can tell the difference between different types of teeth. So if you want a button that charts one specific code if it's a permanent tooth and charts a different code if it's a primary tooth, you can set that up where it's just one button, and Open Dental can tell the difference between permanent and primary and automatically chart the correct code. It can tell the difference between pontic and retainer, molar versus premolar, one surface, two surface, three surface, four surface. There's a lot of different things you can do with these buttons. So we definitely recommend spending some time customizing these buttons to the way that your office charts work. It'll really make things much easier. You can also enter procedures by typing in the procedure code here, or you can go to our procedure list, which just lists all of the procedures and lets you search for a specific code. So we'll see a little bit of all of those. For starters, let's go ahead and say this patient came in with a couple of fillings. So I'm going to start with my entry status of existing other here, and then I'm going to go to my quick buttons. So the quick buttons are the first category here, and they just list all of the common filling surfaces. So in this case, we'll say maybe the patient came in with a posterior composite MOD on tooth 32. So click that button, and it charts the 2393 three-surface posterior composite. It shows up green in the progress notes and green on the tooth chart to indicate that it was existing other. For comparison, we'll go ahead and do an amalgam MOD next to it, and we can see it's a slightly different shade. So just by looking at the tooth chart, I can tell this patient had two fillings. I can tell what surfaces. I can tell that they were already existing when this patient became our patient, and I can tell that one is a composite and one is an amalgam. So next up, we'll go ahead and chart some more work. So I'm going to go ahead and switch over to treatment plan. And let's just chart one more filling. So we'll pick another tooth here. We'll go ahead and chart another MOD. I can see it shows down here at the bottom. It shows up in red because red is the treatment plan color, and I can see it on the tooth chart. Another great example, so that's our quick buttons. A couple of other really good examples here. Let's do a bridge on these three teeth. So rather than clicking on one tooth and charting a procedure, the next one, then the next one, I'm actually going to highlight all three of these at once and do our bridge button. So we have a procedure code here for a bridge, so I click the button, and with one button click, I get 6740 on tooth 1 and tooth 3, the retainers, and I get a 6240 on the pontic. So just one click, and I was able to chart that entire bridge. If I wanted that to chart a seat code or another no-fee code as well, I could easily set it up where when I chart my bridge, I get those three procedure codes plus another code. A good example of that, let's just go ahead and do let's go to endo here. We'll do a root canal buildup and crown here. So I'm going to click on tooth number 16 and then my procedure button here. And again, with one button, I get a crown, a core buildup, a root canal, and a seat. Very customizable. These buttons are a great way to chart work. Another option is we can chart directly by procedure code. So if I wanted to do, say, tooth 15 here, I wanted to do an extraction, and I happen to know that's 7140. I can type in my procedure code here and click OK. And I get my extraction here on tooth 15. If I don't happen to know the procedure code and I don't have a shortcut for it here, I can always do my procedure list. So for example, let's do a surgical extraction on tooth number 17 here. I'll go ahead and I'll say I don't know the procedure code, so I'm going to go to my procedure list. Now I have a list of all of my procedure codes. I can search by abbreviation, by description, by code, or by category. So in this case, we'll go to oral surgery and we'll do a surgical extraction. So double click that there, and here I have my surgical extraction on tooth 17. One more example, Open Dental is always trying to catch any mistakes. So I'll show you another example. Let's say we wanted to do a filling. Let's say we want to go ahead and chart a filling. So we're going to say tooth number 4, and I just happen to know I want to do a 2391. In this case, this is the code for a filling, and I haven't indicated any surfaces. So when I click OK, it's going to pop up a message saying that we're missing some information. So I can go ahead and select my surfaces here. And in this case, I've indicated 2 surfaces, but the code is a 1-surface code. So when I click OK, it's going to warn me that it recommends the 2392 is the recommended code for a 2-surface posterior filling. So I'll click yes, and it'll automatically change that code to a 2-surface posterior. So Open Dental is always kind of looking for ways to make things simpler, to make sure that things are accurate. One last thing, we'll go ahead and treatment plan a comp exam here because we're doing our new patient visit. Referring out work is very easy, so I could change to a referred status and then chart some work, and it would automatically be referred. So a great example would be our surgical extraction here. Maybe I decide I want to refer that out instead of doing that here. So the best way to do that would be to change my status to referred and then chart the procedure. If I find that I've already charted the procedure and I want to make some changes, I can always double-click on the procedure here and change anything I want. So I'll go ahead and double-click on my procedure. I can see that it's currently set to treatment planned, and I'm going to go ahead and change that to referred. So I'll double-click here. I have the ability to change the procedure code. Maybe I have already charted it. I've got the right date. I've got the tooth. I've got it all set up. I don't want to delete it, but maybe I want to change it from a surgical extraction to a regular extraction. I can change the procedure code here. I can change the date if I need to. I can change the tooth number, the billed amount, the provider. Here's where I'll enter my notes. We'll come back to that in a little bit. I can change the procedure status here. So for example, I'm going to change this to referred out. And I can enter more information on that referral. So for example, I'm going to hit these 3 dots here. And I'm going to say we're going to refer this to Dr. Smith in oral surgery. So I'll click OK. If I want to, I can double-click on this referral and enter more information. So I can specify a referring provider if I want to. I'll go ahead and click OK. I can generate a referral slip. So referral slips in Open Dental, like most of our sheets, are completely customizable. You can add your office logo to the background. You could have a referral slip for each different office that you refer work to that has their logo in the background. It automatically fills in information about the office. It will automatically fill in patient information. Now, in this case, I haven't entered an address or phone number, so there's a blank space here. I can enter notes. I can easily print or email this referral slip. I can create a PDF, or if I just want to hit OK, it will be tracked in the patient's chart here. So if I go to the bottom of the patient's chart, here's my oral surgery referral slip. I can always come back here and see that referral slip, and I can always double-click here to keep track of my referral. I can run reports on how many people I've referred out, who I've referred people to, who's been referred to me and from who. Very easy to keep track of all your referrals in and out in Open Dental. So now we can see my progress notes here are getting a little complicated. I've kind of got a lot of stuff here. So maybe at some point you're looking for something, like you're looking for a procedure for tooth 16, but it's kind of buried in all this other stuff. If you ever find yourself looking at too much information, you can always go to the Show tab and specify exactly what you want to see. So I usually recommend starting with None, and then you can indicate maybe you want to see appointments and treatment planned work. Or maybe another provider wants to see appointments and completed work. Maybe existing work. We'll say existing work because we have some in the chart here. You can indicate that you want to see sheets. So for example, that oral surgery referral slip, if I was looking for that, I could easily say I only want to see the sheets, and there it is. I can specify date ranges. So you can say you only want to see procedures going, for this year or last year, or you can type in whatever date range you want. I can say I want to see procedures for a specific tooth. So for example, if I want to say maybe tooth 15 and 16, I want to see what's happened on these two teeth. I can choose the selected teeth option, and I see all the procedures, whether they're treatment planned, complete, referred out. I can see everything that I have regarding those two teeth. It's a very easy way to find a particular procedure if you're looking for something. And I can save those views. That's one of the handy features, is you can save those views and easily switch back to them using the function keys. So for example here, I have it set up as F1 is my clinical notes, so that just shows me everything. F3 is treatment plan procedures, so that only shows me the treatment plan procedures. So if I'm on my Enter Treatment tab and I want to see everything without even having to switch to the Show tab, I can just hit F1 and I'm seeing everything. F3 and I'm looking at treatment planned work. So if you ever find yourself having too much information in the progress notes area there, you can always modify that and make that show just exactly the information you want. The last tab over here, the Draw tab, is useful for anything we don't already have a graphic for. So I already have graphics for fillings, for bridges, for crowns, extractions, root canals. If you want to indicate something that we don't have a graphic for, you can always come here and go to the pen and indicate anything else you're interested in. So for example, maybe a crack in a tooth. Or maybe I want to switch to the red color here and maybe indicate an abscess. This kind of lets you draw anything you want to on the tooth chart. You can easily erase those. You can easily change colors. Very easy to indicate other things on the tooth chart here. You could also use that to indicate, for example, maybe a supernumerary tooth. All right, so now we've treatment planned some work. We've kind of done maybe we've done our comp exam. We've looked at everything, and we've kind of got an idea of what needs to happen for the patient. So the next step, this particular patient has a lot of things that need to happen. We probably want to organize that, prioritize that treatment, and then maybe generate a treatment plan for the patient that's nice and simple and maybe just shows what we're going to do on the next visit. So I'm going to go to the treatment plan module, and I can see all of my treatment plan procedures. So this is the default treatment plan. The default treatment plan will always update. It's always going to be a current representation of the treatment plan for your patient. If I complete this comprehensive exam today, it'll disappear from the list because it's no longer part of their treatment plan. It's been completed. If I treatment plan more work, it's going to automatically show up here. So for here, I'm going to say the comp exam we're going to go ahead and do today, and maybe I'll just say we're going to do the comp exam in one of these fillings today. So maybe the next visit, the highest priority is this other filling. That's what we're going to do next. So I'll say that's priority 1. The bridge, maybe we'll go ahead and say the bridge is the second priority. We'll do our root canal build-up seat here for our third priority, and maybe we'll hold off on the rest of this. We're just going to say wait on that. Now I can see that this is red. This has been customized. By default, they'll all be black. We made this red just as an example of how you can customize the colors. You can customize these priorities. You can change the order in the list. You can change the names. So if you prefer to have this be visit 1, visit 2, visit 3, very customizable. I can see that I have subtotals for each of my visits. Now in this case, we don't have the fees entered in Open Dental, so this is the only one that actually has fees for some of these procedures. But if I had all my fee schedules set up, it would show me my fees here. And I can easily save these treatment plans. So I'm going to highlight this particular procedure. This is the next visit, and I'm going to save a treatment plan. Now I can see up here I have my default treatment plan, but I also have a saved treatment plan. So the saved treatment plans are basically snapshots. If I complete this filling, it'll indicate over here that it's been done, but it'll still be here. The saved treatment plans don't ever go away. You can delete them if you want to, but they won't go away on their own. This procedure would disappear from the default treatment plan if I complete it, but not from here. I can double-click here and give it a different name. I can change the default text here if I want to. I can have the patient sign it. So if I click on Sign Treatment Plan here, it'll show me what it looks like. It has my practice information here, our tooth chart, and the procedures that are going to be done on this. If I have a topaz pad or a touchscreen with a stylus, I can have the patient sign it. And I'll click OK. Now it indicates that we do have a signed treatment plan. I can print that treatment plan. I can email that treatment plan. And just by saving it, it's already sent a PDF copy to the eClinicalWorks progress notes. So the patient documents in eClinicalWorks have a copy of the treatment plans. That way, if you have a medical provider that doesn't, maybe they don't even have Open Dental installed on their computer, they can always see the treatment plans for the patient. Dental providers as well, you can see the treatment plans for the patients without actually launching Open Dental. And that does happen automatically. So if I were to save another treatment plan, we'll go and save the next visit as well. Save that. We'll give that a different name. So now I have 2 treatment plans saved for my patient. I could print them out and discuss with my patient what's going to happen, and they both are already sent to eClinicalWorks. So the next step, we'll go ahead and go back to our chart module. So we've already talked to our patient about their treatment. We've completed our comp exam. We've discussed what the next steps are. Now it's time to go ahead and tell Open Dental that we've completed these procedures and enter some notes. So the next thing I'm going to do is I'm going to go to my appointment. Now, anything that is happening today is automatically highlighted in yellow, so it makes it nice and easy to find my appointment. It really stands out. It's the big yellow line here. The appointment is very important in the Open Dental eClinicalWorks interface. It transfers automatically from eClinicalWorks, and when I'm done with my procedures, I'm going to attach the procedures to the appointment and then send that appointment back to eClinicalWorks. That's how information gets back into eClinicalWorks. So it's very important that we attach the procedures to the appointment and set the appointment complete. So I'm going to do that now. I'm going to double-click on my appointment, and I see a list of all the treatment plan procedures. So this is where I'm going to select what I did today. I'm going to say that we did our comp exam, and I'll just say that we did one of these fillings as well. So these are the 2 procedures that I'm attaching to my appointment. And now I'm going to set my appointment complete. So I'm going to go to the status here and change it from scheduled to complete. And I'm going to click OK. So I can see a couple of things. I can see on my appointment now I have my filling and my comp exam attached to the appointment. And those 2 procedures are highlighted in yellow, and their status is changed from treatment plan to complete. The color on the tooth chart here for the filling also changed from red to blue because it's now been completed. And finally, I see I have a default note here for the comp exam. So you're able to set default notes for all of your procedures. So if you have an outline of text that you want to have for a procedure where as soon as that procedure is complete, it automatically shows up, that's very easy to do. You can even customize that for each individual provider. So different providers can have different default notes. You can also manually enter notes. So if I double-click on my procedure here, I can come in here and enter more notes. And I'll click OK, and I can see my note here. The next option we have is what we call auto notes. So auto notes are very convenient. They basically let you specify a template. So you can have a template, a note template that would automatically fill out a block of text, but they will also help you fill in that text if you want. So for example, where you specify medications, maybe most of your patients are taking a similar set of medications. So rather than have it just fill in a template and then you go back and manually type in these medications over and over again, you have the option to have a prompt pop up where you can actually just check off options from a list and say the patient is taking this medication and this medication. And then you don't have to go back and manually type in that information. So I'll show you an example. I'm going to click on Auto Notes, and we'll do our comp exam auto note here. So we can see it fills in a block of text here. But where it says medications, it actually pops up a list of medications that I can choose. These are completely customizable. You can set these up however you want. I'll say OK. Allergies, and I can see here it's going to let me choose multiple options if I want to. Blood pressure pulse, so it lets me come in here and type in some more information. Okay, chief complaint. I can indicate, you know, the post-op instructions were handed to the patient. TMJ issues, here this is an example of a single choice pop-up box. I can indicate only one of these 3 options. Okay, and I'll just skip this one. I can see that that kind of filled out my note for me. And now because the pop-up box told me to enter my blood pressure and pulse, as long as I enter all that information, I know that I haven't missed anything. So it can really help you enter your notes quickly and easily. I'll say OK here. And now I have my auto note. I can sign it, again, if you have a Topaz pad or a touchscreen with a stylus. And I'll click OK. And here I have my note. If I need to make changes to the note, I can always double-click the note and come in here. Now, if I were to change anything, even as simple as removing a blank space, it is going to remove the signature. So signatures in OpenDental are always tied to a set of data. If that note changes in any way, you would have to re-sign the note for security purposes. In this case, I'm not going to re-sign it. I'll just say OK. And here's my note. Now, if you're concerned about security, we do track every version of the note. So I can always go to my Show tab and go to my Audit. And I can see every different version. So it started off with default notes. I added more notes. Then we had this note here, and it was signed. And then it was modified and not signed. You can see what user modified the note, what time they modified it, and what changes were made. You have additional security beyond that. You can specify that certain users don't have the ability to edit completed procedures. You can also put a time limitation on it. So you can say that some users can edit completed procedures up to the end of the day, but after the end of the day, they're not able to make any changes. You also have the option to do a lock, so I can come in and lock my note anytime I want to. I'll come in here, and now it indicates that that note is locked, so I can't make any changes now. There's no way to get rid of that note. There isn't any security permission, admin rights. That note is basically there forever now. I can append notes to the end of it if I want to. I can sign the additional notes, and it will show at the bottom here, but that note itself is now locked and there forever. I can also invalidate the procedure if, for example, maybe I had the wrong procedure code or something. Another version of notes, if you wanted to do a note that applied to more than one procedure. So this is how you would do a note for the comp exam. You would double-click on the individual procedure. If you wanted to do a note that applied to multiple procedures, I could highlight these two procedures together, or as many procedures as you wanted to. Right-click and do a group note. Oh, and it won't let me do a group note on a locked procedure, but the group note would look like this. It would show all of the procedures that are attached to that group note. You still have the auto note option. You still have the signature option. And it would basically just attach that group note to a set of procedures instead of one individual procedure. That's handy for something like a bridge where maybe there's 3 or 4 different procedure codes that make up one procedure that you want to put a note on. The next step, so this is a very, very important step for the interface. So we created our appointment in eClinicalWorks. It showed up in OpenDental. We charted some work. We completed some procedures. The last step is that we have to tell eClinicalWorks that we've completed these 2 procedure codes. So far, eClinicalWorks doesn't know what we've done. So the last step here is I need to go back to my appointment. I'm going to double-click on my appointment. And I'm going to use this Finish and Send button to send these procedures back to eClinicalWorks. Now, I always recommend that you pause for a minute here and make sure that everything is correct. If I send this, if I hit this Finish and Send, and it turns out some information is wrong, I need to correct it in both OpenDental and eClinicalWorks. So the first time I hit Finish and Send, everything's going to happen automatically. It's very easy. It's very convenient. These procedures will be sent to eClinicalWorks. They'll automatically show up nice and easy. If I hit that Finish and Send and then I realize, oh, wait a minute, that was actually tooth number 29, not tooth number 30, I would have to come in and change that tooth number to 29 in OpenDental, but that would not automatically update eClinicalWorks. I would have to go into eClinicalWorks separately and change that tooth number there as well. So that's not a hard thing to do, but it's easier if you get it right the first time. So I just recommend that before you hit that Finish and Send, just pause really quick and just make sure that everything we did is attached to my appointment. If I did the root canal, I need to make sure it's highlighted. If I didn't do it, I need to make sure it's not. So I'm going to verify, yes, I did do my composite, resin-based composite filling today, and I did my comp exam. So that looks correct. I'm going to go ahead and say Finish and Send. It's going to tell me it's going to send the attached procedures to eClinicalWorks and exit. And that's what I want to do, so I'll say OK. and it takes me back to eClinicalWorks. Now, I'm going to go to the patient documents in eClinicalWorks, and I can see 3 documents here. I can see 2 saved treatment plans, so we did save 2 treatment plans for the patient. They're here in eClinicalWorks in the patient documents automatically, so without launching OpenDental, I can go look at the treatment plans and the progress notes as well. So I can see their dental progress notes without even launching OpenDental. And every time you hit that finish and send, it's going to send a copy of those progress notes, including any notes that you had entered in OpenDental. If I scroll down here in the progress notes, I'll see the procedure codes that we completed. So that's really important because now eClinicalWorks knows that we completed a filling and a comp exam. From here, you could collect the patient balance, you could create your insurance claim, do your billing. Everything from here out can be handled the same way it is for a medical patient. All of your statements and everything can be generated now. Your meaningful use data is here because eClinicalWorks knows what procedures were completed, and you're pretty much done. Now, obviously, there's a lot more to it. There's a lot more features in OpenDental, so we'll go back and get into some of that. But the key part of the interface that's really critical to understand is you start off in eClinicalWorks, you create the appointment. That appointment shows up in OpenDental. You chart your procedures in OpenDental, do your treatment planning. You attach those procedures to the appointment, and then hit that finish and send to send the procedures back to eClinicalWorks. Those are the critical steps. So we'll go ahead and go back into OpenDental. So I'm going to go back to the details and view dental chart. And one common change to that workflow that we did, one thing that a lot of offices do differently, is that maybe you don't have time to enter your notes. Maybe your patient comes in and you do your comp exam and you finish your comp exam and maybe the patient's getting up and they're ready to leave. And before you can do billing, before you can do your patient portion in eClinicalWorks, you have to send those procedure codes to eClinicalWorks before you have time to do your notes. So if that's the case, you can follow basically that same procedure, except don't do your notes. You would double-click on your appointment, finish and send, and then after you've sent the procedure codes to eClinicalWorks, you would launch OpenDental again, go in and do your notes at that point. So for example, now if I wanted to enter notes on my filling here, I could come in and enter whatever notes I wanted to enter and say OK. And now I don't have the finish and send option again, but I can send an updated notes PDF. So if I make any changes to the notes, I can always send an updated notes PDF, and I can do that as many times as I need to. So anytime I go into OpenDental and change any notes, I can always go back to my appointment, double-click on my appointment, and hit this Notes PDF button. So that sends an updated Notes PDF. So if you have to finish and send your procedures before you have time to finish your notes, you can always go back later, finish your notes, and then send that Notes PDF. I can see that I don't have the finish and send option again, but I do have a revise option. So if I did need to make a change, for example, if I needed to change this to a different tooth, I could click the revise button. It's going to warn me that any changes I make will not be sent to ECW. You will have to make the same changes in ECW. I could click OK, and now I could detach that from the procedure. I could change my tooth number if I need to, make any changes that I need to make, and then say OK, and I can see that that's moved to tooth number 29. The dental chart is completely updated. Everything's all set in the dental chart, but if I go back to eClinicalWorks, it's still going to show tooth number 30. So I would have to manually change that in eClinicalWorks as well. So that's kind of how you would handle that if there was a mistake after you hit the finish and send. You would use this revise option to fix the procedure in OpenDental, and then you would fix the procedure manually in eClinicalWorks as well. Okay, so we'll cover some of the other options now in OpenDental, and we'll kind of start at the top here. OpenDental can handle lab cases. So this is one of a lot of examples that we'll cover where you have the option of doing lab cases in eClinicalWorks or in OpenDental. Now, if you do the lab case in eClinicalWorks, there is a labs area here on the medical panel. So if you enter the lab in eClinicalWorks, you would be able to see that lab from eClinicalWorks and from OpenDental. If you use OpenDental to create the lab case, it's only visible from OpenDental. It will not automatically send that information back to eClinicalWorks. So a lot of offices find it easier to use eClinicalWorks for that, but it is a feature that is built into OpenDental. It works very well. It's really up to each individual office and their workflow where they want to enter their lab cases. If you do use OpenDental for lab cases, you can specify as many labs as you like. You can specify different procedures for each lab. It can automatically generate a date and time due. You can enter instructions here. You can keep track of when the lab was created, sent, received, and quality checked. You can generate lab slips. Just like most of our slips, these are completely customizable, so each lab could have their own custom lab slip. It automatically fills in information for the doctor. It automatically filled in information for the patient. I can have default notes, but I can always enter more notes anytime I want. I can do signatures. Again, I can print it, email it, create a PDF of it, and it's always going to be there in the patient documents. So if I say OK, now I have my lab case here. I can see that I have my lab case and that it has been quality checked. If you do enter lab cases in OpenDental, it's very convenient. One great thing you can do is you can have an appointment view that shows, appointments and lab cases. So you can see upcoming appointments and any available lab cases. You could check and see if they had been created, if they'd been sent, if they had been received. Lots of options if you use OpenDental to track the lab cases. If you do use eClinicalWorks, then that information would be here on the Medical tab. Perio charting is very easy to do in OpenDental. I can see my perio chart here. I'll just add a new exam. I can enter values for my probing depths here. I can change my advanced direction if I want to. I can indicate that I want to enter information in triplets. I can indicate at any probing point, I can indicate plaque, calculus, bleeding, or suppuration. I can see that the teeth that are missing are automatically grayed out, so it will automatically skip over them. If I want to indicate additional teeth, I can always skip additional teeth from here. This does work with the DentalWrap foot pedal. It works with standard voice recognition software. A lot of great options to help you enter data. You can enter probing depths, mucogingival junction, gingival margin. It will automatically calculate the clinical attachment level. You can enter furcation, mobility, and once you've entered all that data, you can generate a very nice looking 3D perio chart. So it takes a little bit of work to enter all that information, but I'll show you what one of those looks like. This is what a completed perio chart might look like with all the information. And then you can generate this nice looking 3D perio chart. So we can see the plaque and the bleeding, and we can see all of our depths here. It does automatically save. You don't ever have to worry about clicking save or losing any of this information. And additional exams are kind of in line here where they'll be, we'll change our direction there, where they'll show up just kind of right next to the previous exams. Obviously you can print it, you can save it to the images module, and the graphical would generate the graphical perio chart that we just looked at. Consent forms, another great example. They can be done in eClinicalWorks or in OpenDental. If you create a consent form in the patient documents in eClinicalWorks, they would be available from down here. I can see the patient documents here, so if you had a consent form here in eClinicalWorks, it would show up in OpenDental. If you do use OpenDental for the consent forms, they are completely customizable, so I'll show you an example. This is an extraction consent. Really a lot of things you can do there. They're very powerful. When I click OK, I have the extraction consent here in the patient's chart. It's always available here. Next option is the tooth chart. I can show a large copy of the tooth chart. This is handy for explaining treatment to patients or referring work out to a referral. Very nice, easy way to see a large copy of the tooth chart. I can save it to the images module. So that's useful for mostly ortho and pediatrics offices where there might be a lot of movement over time and you kind of want to take a snapshot of that tooth chart. That'll be available here. We'll talk about the images module more in a minute here. I can do exam sheets. So I'll show you an example of a customized exam sheet we have here in our system. I can see I can use checkboxes here. I can fill in notes in text fields. I can include pictures. Huge number of things you can customize on our sheets here. Again, like all of our sheets, you can print, email, create a PDF, or I'll just click OK, and I have the exam here. If I add more exams, they'll show up in a list here. I have the ability to add as many different exam sheets as I want. Communication logs are a great way to keep track of communication with your patient. So maybe it's insurance related. So maybe I want to indicate that the patient called to update insurance information. I can indicate that it was a phone call we received. I'll say OK. And I have a communication log in my chart now. So the communication logs are a great example of one of the things that you can show. So if I want to see all of my communication logs, very easy to do that. Pop-ups are very handy for things that are just really critical. You just want to make sure that they don't get missed. So for example, maybe this patient has a severe allergy. So I can add a pop-up, and then the next time I launch this patient's chart, every time I launch the patient's chart, that's just going to pop up automatically and give me that information. So if I'm worried that someone might miss the allergy, I mean, the allergy is listed here, but if I just want that message to pop up and just make sure that that information is noticed, I can create a pop-up, and it'll pop up every time that patient is selected. The imaging software. So here I have, for example, I have a button that says DEXIS. You might use Aptrix or VixWin or any of a dozen different imaging softwares that we bridge with. And that software will be your imaging software. So OpenDental doesn't actually take your images. We don't actually store your images. What we do is we bridge with the third-party software that does that. So you'll have a button up here. It'll have the name of your imaging software, and when you're ready to take images for this patient, you'll click that button. It will automatically launch your imaging software, and it'll automatically bring up that patient. So it's a third-party software, but it's very smooth. All you do, you just click one button, and you're looking at the patient's images. If this is a new patient, when you click that button, OpenDental will launch the imaging software, will create a new patient in the imaging software. They'll have the same ID number that they have in OpenDental, and will pass their date of birth, all the important information. You'll hit that one button, and you'll be ready to take your images. The images module here is separate. So the X-ray imaging is handled through the third-party software with a program link button here. The images module is a document repository. So here again, a great example of something that is available in eClinicalWorks and OpenDental. If you have dental-specific documents that you want to store in the images module here, you certainly can. If you scan those same documents into the patient documents in eClinicalWorks, they would be available from eClinicalWorks and from OpenDental. So a lot of offices will not use the images module because anything you put here is only available from OpenDental, but it is available. If you have documents that are dental specific that you don't care if they're available to the medical providers or available from eClinicalWorks, you can use the images module here. It is very easy to import documents into the images module if you already have the documents on your computer. You can scan new documents. If you have a scanner hooked up to the computer, we can do single page, multi-page, image scanning. Very easy to add documents here. I can easily move documents between different folders if I want to. I can delete the images, and this is kind of where the patient documents are stored in OpenDental. The family module. By default, the family module basically only shows you the fee schedule that the patient is on. So the way that fees are handled with OpenDental and eClinicalWorks is the patient is assigned a fee schedule in eClinicalWorks. The name of that fee schedule is transmitted over to OpenDental in the message that's sent when you create the patient or when you create an appointment. OpenDental looks for a fee schedule with that same name. So what you would do is you would set up all your fee schedules in eClinicalWorks, and then you would export those fee schedules and import them to OpenDental. So OpenDental should have a list of fee schedules that matches your fee schedules in eClinicalWorks. So in this case, I have a sliding fee schedule, a couple of sliding fee schedules, a master fee schedule, and eClinicalWorks would send a message saying this patient is on the master fee schedule. Assuming that fee schedule exists in Open Dental would have all the right fees, and the treatment plan here would show the fees for these procedures. If you don't want to do that automatically, you do have the option to specify a specific fee schedule here in Open Dental. Without having it automatically sent over, you can come here in Open Dental and specify a fee schedule for a patient. The other option you have for this family module is we can turn on a more comprehensive family module. And what that would give you is it would give you the ability to enter insurance information into Open Dental. So if I go to my treatment plan module, I can see that we actually do have the ability to show the fee for a procedure, how much the primary insurance is going to pay, how much the secondary insurance is going to pay, what the discount would be if there's any kind of write-off, and what the patient portion would be. So if you want your treatment plans to show all that information, we would have to enable the comprehensive family module, and the other part of that is you would have to re-enter the insurance information into Open Dental separately. Unfortunately, that information does not transfer directly from eClinicalWorks into Open Dental. So if you do want to re-enter the insurance information, you can generate treatment plans that show not only the fees, but how much insurance is going to cover, what the write-off is, what the patient portion is, and then you could also use Open Dental for pre-authorizations. So for example, I could easily generate a pre-authorization. I don't have insurance set up for this patient, but I would choose what insurance plan they were on, the relationship to the subscriber, and I could do pre-authorizations through Open Dental. If you're interested in doing that, let us know. We can turn that on for you. There's no additional fees for that or anything. We'd be happy to walk you through those options and show you how to use insurance inside Open Dental. So back to the chart module. We're getting pretty close here. We've kind of covered all the major features. A couple other things that are very important to know. Under the help option here, you have help, and if I go to the online help contents, it'll take you to our user manual. Now, some of this information is going to be useful and some of it won't. So for example, the appointments module, you're going to do all of your appointments through eClinicalWorks, so that's not going to be terribly useful for you. The family module would only be useful if you're in what we call full mode, where you're entering insurance information. The account module you won't use in Open Dental. But for example, the chart module, this shows you how to do, primary teeth, or if you had a question about perio charting, for example. There's a whole bunch more information here in the manual. The other great option from the help option here is that was the contents. If I go to the index, I can search. So for example, if I wanted some more information about the perio chart, I can type in perio, and here I have perio charting. If I wanted more information about treatment planning, I have entering treatment, treatment planning, discounts, signing treatment plans, all this information here. Referrals. This can tell you how to do referral tracking by procedures, how to change the referral slips. Lots of great information here. If we go to just our homepage, opendental.com, there's a link down here for webinars. If I see this webinars link here, or I could search for webinars, these are recorded videos that talk about how to use Open Dental. So again, you'll want to keep in mind that some of these features you won't actually use. So for example, insurance, most people will not use insurance in Open Dental if they're using the eClinicalWorks interface. But sheets, so customizing sheets, this would tell you how to create a custom consent form, or a custom referral slip would be a good example. The chart module, main window, toolbar features, perio charting, procedure buttons, auto codes, and quick buttons. So this is a recorded video that would tell you how to set up these buttons. So for example, if I wanted to create this new patient button, new patient visit button, where I click one button and it charts 4 or 5 different procedures, this webinar here would kind of tell you how to do all that stuff. So this is another great place to get information. Beyond that, you do have unlimited support. So another great way to get more information is to email us at ecw@opendental.com is an email address that goes to a group of eClinicalWorks specialists. So you're always welcome to email us with any questions. The other option is you can always call us. I'll put our main number up here. This is also available, obviously, on our webpage. If you go to the home page, our number is here, and the Contact Us page lists our hours here. So feel free to call us anytime with additional questions. Email us if you have any additional questions. We would definitely be happy to help. Obviously, we've kind of covered a lot of information in about an hour here. If you have any additional questions, any other features you're curious about, if you want more information about insurance or anything else all we can do for you, definitely give us a call anytime. Thanks.